I'm Dr. Paul Batty. I'm a postdoctoral fellow at Queen's University, Kingston, Ontario. I'm going to present the data from a recent abstract we presented at the Virtual ISTH Congress in July 2020. The title of this poster was Long-Term Vector Genome Outcomes and Immunogenicity of AAV Factor VIII Gene Transfer in the Canine Hemophilia A Model. In the last few years, we've heard impressive data from the clinical hemophilia gene therapy programs. For Factor IX, we have heard follow-up approaching 7 years, and for Factor VIII, data has now been reported at 4 years. There are, however, a number of questions surrounding the long-term safety and efficacy of AAV-mediated gene therapy. The dog hemophilia A model has been a preclinical testing standard for novel therapies in hemophilia for the past 3 decades. In more recent years, this has provided a good way of studying long-term outcomes of gene therapy-based approaches in hemophilia. So the aims of this study, which started more than 15 years ago, was to try to answer some of these unknowns surrounding long-term efficacy, safety, and immunogenicity. At the start of the study, 8 of our severe hemophilia A dogs were treated with an AAV canine factor VIII vector via a single portal vein infusion. The dosage used in this study ranged from between 6 × 10 to the 12 up to 2.7 × 10 to the 13. 4 of these dogs received an AAV 2 capsid, 3 an AAV 6, and a single dog an AAV 8 capsid. We saw a treatment response in 6 out of the 8 dogs treated with AAV factor VIII. In the remaining 2 dogs, no factor VIII expression was seen throughout the course of the study. We then looked at the bleeding phenotype in the dogs throughout the course of the study, and these dogs were followed up for between 8 and 12 years. Looking at the number of hemostatically treated bleed rates, so the ABR, there was a reduction in bleed events from 4 events per year to 0.2 events per year prior to and following treatment. Next, we looked at the factor VIII activity across the course of the study. The samples that were studied were plasma samples that were cryopreserved throughout the duration of the study, and these were measured using either a 1-stage or a chromogenic assay against the canine normal pooled standard. We saw a treatment response in 6 out of 8 dogs treated with AAV factor VIII. The dogs were monitored long-term for 8 to 12 years after treatment. Firstly, looking at the phenotype of these dogs following treatment in terms of their annualized bleed rates, we saw a significant reduction in the hemostatically treated ABR, reducing from 4 events per year to 0.2 events per year following treatment. At the end of the study, a full post-mortem examination was performed on all animals. The liver tissue was submitted for independent review by 3 blinded independent histopathologists. Importantly, in the liver at post-mortem, there was no signs of chronic liver disease or of tumours. We then looked by qPCR for the presence of viral AAV factor VIII vectors in all organs that are being cryopreserved at post-mortem. AAV factor VIII forms were seen in the liver of all dogs studied, with lower levels seen in the spleen in 4 animals. No other sources of AAV factor VIII were seen in any other organ studied. We then looked to see the sites of factor VIII expression by RT-PCR. Factor VIII mRNA was only detected in the liver of the 6 dogs that responded to treatment. So then, to gain more detail of this tissue, we looked for the presence of episomal AAV factor VIII forms in the liver using 2 different techniques. Within these experiments, we demonstrated the presence of full-length circular episomal AAV canine factor VIII by digital droplet PCR and Southern blotting. Using the Southern blotting assays, the predominant form of this was in a head-to-tail configuration. Finally, we looked to answer questions regarding long-term immunogenicity to the AAV capsid across the course of the study, using a cell-based in vitro transduction assay. The predominant immune response was towards the dose capsid, with limited cross-reactivity towards the non-dose capsids. In 1 dog, there was some cross-reactivity seen towards the dose capsid, which was AAV6, and also a non-dose capsid AAV2. Although there was a decline in the antibody titer towards the dose capsid with time, the levels seen at the end of the study are at a point which would potentially prevent redosing with the same capsid. So in summary, persistent factor VIII expression from hepatic source was found 10 years after dosing with a single infusion of portal vein AAV factor VIII. At this endpoint, there is persistence of episomal AAV factor VIII forms. The long-term immune response to the AAV capsid lasts for at least 10 years, and the levels that we see would potentially preclude redosing in the future if needed.